Welcome to On the Beat. Today I am joined by Dr. Ricky Johnston and Dr. Richard Hurd with Gastroenterology Associates of Columbus and Starkville. And we have spent time the past couple months talking about colonoscopy screenings, but that is not the only way to screen the colon. Is that correct?
Right, yeah. Colonoscopy is our most common method that we use these days, and that's what we recommend most. But I think it's important for people to understand that there are some other alternative methods that are recommended by some of the societies that make cancer screening guidelines. Some of those things include stool tests for blood or for DNA that could be shed from polyps or tumors. There's x-rays such as barium enemas or CT scans. What else am I missing? Flexible sigmoidoscopy. That we perform a colonoscopy, but a flexible sigmoidoscopy is not done much anymore, but that's a more limited examination of the colon, the last couple feet, as opposed to the whole thing.
And how do I know which one is best for me?
Talk to your doctor mostly.
Okay.
I think the important thing to remember is that, most of these tests, actually none of these other tests other than colonoscopy actually prevent colon cancer. They are, and a lot of them are limited in their degrees of preventing colon cancer, giving you that early warning. Some of them aren't that good at picking up those earlier polyps like we can with colonoscopy to remove those.
Right, because you're in there, you can remove the polyps right there.
Sure.
Now, a lot of commercials out there and a lot of people talking about Cologuard. Is that recommended? What are your thoughts about that as a
I think it has a place, but we don't use a lot of it. And we certainly get some referrals for people that have used it and had a positive test, because I think it's important for everybody to know just because you submit the test, you're not done. If it's positive, that's going to be followed up with a colonoscopy. So we get some referrals for people that have had that done, ordered by the primary care providers. I think it has a place for some people who maybe can't have a colonoscopy for some reason because of a transient medical issue that maybe they'll be fit for a colonoscopy down the road, but they're not at the moment. Or for people who just absolutely refuse to drink the colon prep.
Mm-hmm. Well, and the other thing, you're going to say something.
Yeah, well, I was going to point out that it's actually kind of narrow, the people who qualify for Cologuard, because if you ever have family history of colon cancer, that makes you not average risk, or if you're having gastrointestinal symptoms, that disqualifies you. You need to go the colonoscopy route. Everybody has gastrointestinal symptoms, so at some point in their life. So where do you draw that line? That's a little fuzzy. It's hard to know where to put that.
Well, and the great news is that there are so many options, and like you said, depending on your individual situation, you all can work through the process to find what is best for your patients.
Yeah. And I mentioned a lot of things at the top, but in reality, not many of those are used anymore. I think the things that are used regularly, obviously colonoscopy is the most common, but there's Cologuard and some of the other like stool tests for blood that primary care providers can perform in their office, or send people home with a stool card and they submit them back. The other stuff is not that common anymore.
And blood test?
That's kind of new on the horizon. We were actually involved in a research study. We participated in a trial with that and helped collect some patients, but that's probably TBD. I think it's probably coming, and we're not sure how it's going to fit in. It's probably similar sensitivity, accuracy to the Cologuard test, and as he mentioned with Cologuard, the blood test does not have the preventative aspect that colonoscopy does.
Well, wonderful. Thank you so much for these great options. And if you would like to ask the doctors any questions, you can look at your screen, and that will give you the information about how to reach them.